It is often the question heard round the world, what the heck are those cords underneath my arm? I'm cancer physical therapy expert, Dr. Leslie Waltke. Today, we're talking cording. What is it? Where does it come from? How do I get rid of it? And when is it a big deal? And when is it a little deal? Let's start with, what the heck is it? Cording, as we like to call it, is the presence of string-like or cords underneath the arm or in the arm itself. It's often also referred to as axillary web syndrome, which I don't like for multiple reasons. Number one, I don't like the word syndrome. Number two, it doesn't always come in a web-like form. And number three, sometimes it's in other places in addition to the axilla, including the upper arm, the front of the elbow, the forearm, sometimes the back of the hand. You can even get cording in your chest. Cording can happen as a result of lymph node removal from the axilla or underarm. Whether it's for breast cancer, melanoma, lymphoma, it happens to approximately 30% of people, and we can't really predict who's going to get it and who doesn't get it. And it certainly is not a result as something that you did or did not do correctly. It's not from doing too much, it's not from doing too little. So what happens, it is not your fault. Now, we are not fully sure of the etiology or what causes it, but what we think is happening is when the lymphatic system is disrupted by the removal of those lymph nodes, the system becomes inflamed and irritated, and therefore you can then see or palpate those cords, and then because they're literally right underneath the skin, they sometimes can stick or scar to the underside of the skin. And that in turn then can limit your ability to reach and straighten out the elbow or move normally, and can certainly cause pain. So what do we do about it? What I would strongly recommend is talking to one of your physicians about getting you in to see a physical therapist. There is proof that physical therapy can help cording resolve much more quickly than if you just ignore it and leave it on its own. I know this because I did a study on it back in 2005. The therapist will use their hands to stretch the skin. We will call it skin traction or cording stretch, to kind of help release those pieces of scar tissue that are sticking those cords to the underside of your skin, causing you pain and discomfort. You certainly at home can be taught how to do a stretch on your own, as well as using moist heat, which tends to kind of calm things down and make it hurt a little bit less. Now, anytime you are having pain or discomfort or immobility, it's a big deal, and we want you to get into your physician so they can get you to a physical therapist. However, it is not going to cause any permanent damage or swelling problems, and cording, though it is involved with your lymphatic system, is not the same as lymphedema. They're two completely separate conditions. So if you're having pain or limitation, you need to see a PT. If, however, you can see or palpate a cord, so you can see it or feel it, but it's not causing you any pain, and if it's not causing any mobility problems, it's not causing any weakness issues at all, then you don't need to worry about it. Thank you as always for spending this time with me. I hope you feel more confident and more comfortable in knowing what's going on with your body after cancer surgery, radiation, and chemotherapy. Remember, it's your body, it's your life. Live it well. I'm Dr. Leslie Waltke. We will talk again soon.